We're lucky today to have one of the world experts on how treatment coordinators can be more effective at their position. We're going to spend some time with Tracy Martin from Straight Consulting, and she's going to walk us through a lot of the best techniques for our practices to be more successful and for our patients to accept our best care from the moment the phone is picked up until the moment the patient leaves having accepted our treatment plan. So as I tell you, whenever you listen to this, buckle up or get on the treadmill or grab a drink, but whatever you do not want to miss my time today with Tracy Martin.
Now today we are very, very lucky to have one of my favorite people, a friend, somebody I know from way back when, before her consulting days, Tracy Martin from Straight Consulting. Welcome, Tracy.
Thank you so much. Such a nice welcome. I appreciate that.
Well, you deserve it. You deserve it. And in just a minute, I'm going to ask you to tell us a little bit about how you got to where you are right now. And I don't mean in a car or anything like that. But you know, as you go through the story, it'll be kind of funny because, well, I'll let you tell it. But I know Tracy from way longer than my orthodontic career. So let's start with that, Tracy.
Sure.
Tell everybody about who you are and sort of your path of how you got to where you are right now.
Sure, absolutely. So I am the founder of a consulting company called Straight Consulting. It's recently rebranded from Straight Wire Consulting. So if you've heard that name too, that makes sense. And yeah, I'm pretty homegrown in the ortho space. Just out of high school, went straight into ortho assisting school and became an RDA, and then held every position in an orthodontic practice in startups up to a large practice in downtown Seattle, where I met Dr. Glenn Krieger, the cosmetic dentist. And I was a TC in this practice, and he was the fantastic cosmetic dentist, our partner down the street, who we referred all of our patients to after we got those teeth lined up well. Oh, go ahead.
And to whose practice I did all of my ortho referrals.
Oh, and it was the best.
I send and by the way, when she says partner, I think what she means is that we worked very well together. We were not partners together business-wise, but they were the only orthodontist to whom I referred, with the few exceptions. And it was the kind of relationship I would love to have with my restorative doctors, but it's kind of hard in today's day and age. But sorry for interrupting. But yes,
no, exactly.
We worked on a ton of cases together, and I even referred them my daughter.
Yes. So, and I've actually been worked on her teeth as an assistant. So we go way, way back, and yet we both ended up down in Dallas. So funny.
It's not a coincidence, Tracy. It's not a coincidence.
So weird.
I heard you move there, so I figured I have to move to Dallas. If Tracy Martin's in Dallas, I've got to be there too. And so I sold everything, and I convinced my wife that if you were in Dallas, we had to move there with the kids, and she was totally on board. So,
well, if Tracy Martin's there, for sure, let's go.
Yeah, of course. Yeah, Straight Wire Consulting's there. We're going.
Let's go. Yeah. Pack it up.
When did you get to Dallas?
I think I actually got here after you. So I grew up in Dallas, and then decided to come back here after leaving that large practice in Seattle and working in one or two afterwards, managing and consulting in them, and then decided to start my family and have my twins. And I think every girl, when she decides to start her family, she kind of would like, if she can, to be close to her mother in that process. And I was, giving birth to a litter, so I felt like I needed to have some extra hands on deck. So we came back to Dallas in 2013. So were you here?
You were before me.
Oh, really?
No. I got there at the end of 14. Yeah, it's about 5 years right now.
Wow. Well, we came back here, and I was. While I was pregnant with them, I decided that I would go ahead and work in an office down here in Dallas and TC and manage that practice. It was a startup, and it took off very quickly. I was super excited to be a part of that ride. And then when the twins came,
for the record, he's a really good guy and a really good orthodontist.
Oh, thanks.
You can give him a shout out if you want to. I don't mind.
Okay, shout out to Jared Corbridge. He's great. He's in Frisco, Texas. It doesn't hurt that he's in the city that's the fastest growing city in America. So that doesn't hurt at all. But his heart is the big part that's easy to sell.
Jared is a great guy and a great orthodontist. And probably about 15 minutes from my office?
Yeah, probably about 15.
And it's a great lesson that, we can make our peers look good and give them credit when they deserve it, even if they're not an hour away from us. We tend to get sort of caught up in that. But Jared's the kind of guy that if he practiced 3 minutes from me, I'd still say the same thing. And there's enough low-hanging fruit. Really, he's a great guy, great orthodontist, and his practice deserves everything it's gotten. And I'm sure, of course, you've helped him get there as well. So we'll get more into that in a bit.
Yeah. But yeah, so I mean, I had the twins and thought I'd be a stay-at-home parent from there since, there were so many of them. And about 5 weeks into staying home with them, I decided, you know what? I can't be a stay-at-home mom. That is not what I'm meant for. And I just decided to start a consulting business because I had, so much time on my hands apparently. So I started Straight Wire Consulting, and that was about 5 years ago, and it's been a blast. I mean, we've grown very quickly year after year. We have a great set of clients, and I'm happy to have more. But we've been able to speak a lot this last year, which has been fantastic. Thank you for Orthopreneurs.
You're welcome. And by the way, I knew you, I think, before Orthopreneur. I mean, we met. I remember we met at a coffee shop. We talked about your consulting. I think before Orthopreneurs. I think that was before the whole. Yeah, and again, it's another lesson is that if you have somebody in your town whose opinion you value, who's a consultant or dentist or anybody, we don't have to get something from them in order to give. Right? The more we give, the more we get. And I just saw this person who I didn't really know you well. I mean, we knew each other from when Jordan was a patient, 10, 12 years ago in Seattle. But I didn't really know you well. But still, it was like, hey, let's sit down and talk and see how we can help you with consulting. What kind of things can you learn? And it's just, we can help each other because the more we give, the more we get. And
you gave me so much that day. You gave me so much that day. We met.
It's great to hear.
Oh, that was like year 2, I want to say, of the business of Straight Consulting, and we sat down for coffee, and you just helped me kind of really map out the structure and how what orthodontists needed. I mean, I've grown up in ortho, but I've been the auxiliary. I mean, I understand how the clinical side needs to run. I understand how the sales side needs to run. I understand now, and that first year of the business of Straight Consulting being open, I just spent the first year living at Starbucks, just researching and learning the business benchmarks so that I could be able to, to work with these orthodontists and understand the business side a lot better. But I didn't know how to structure my services to them. And you spent that, that hour, that time that we had, just really helping me kind of define what would be most useful and the best way to serve the docs that I was going to be serving. So that was pivotal. Like I thank you so much for that. That was amazing.
Oh, it was my pleasure. I never even realized it was that big for you. I figured, I'd give you a few opinions and see what you thought. But, again, we all have these opportunities, and you've given back 100-fold. I know that for a fact. And I think in this day and age when, our roles as orthodontists and as consultants are getting sort of narrower in many respects because of the outside pressure put on us, I think it's really important for us to come together. And am I perfect at it? Absolutely not. Are there people out there who I don't think are as good people as you are, and maybe I'm a little bit more hesitant to help, perhaps? But at the end of the day, we need to help each other as much as we possibly can. And the overwhelming majority of the people we interact with on a daily basis are good people. And to me, it's really weird, Tracy, that now we've got the Orthopreneurs meeting, and you're one of the 50 exhibitors there. I know you're there for life. Consult or die, right?
Mm-hmm.
Tattoo, I think it says. But at the end of the day, it's nice because, you've seen everything happen along the way, and I've seen your business grow because people love you. And I want to take a second, if I can, talk to me a little bit about, because I put a course together. Well, I had you take your course and do it for my Orthopreneurs RD TCs, where they all came to Dallas, and you had this amazing one-day course. But talk to people out there first to start with, what is it you do typically? Like, what is your area of expertise, and how do you present that to the public? What is it that, how would people get to know you in a first time if they didn't call you in to consult in their practice at first?
Sure. Yeah, absolutely. So, like you just mentioned, we definitely do a lot of on-site consulting. That's what we do the majority of the time. But twice a year, we throw these TC mastery courses, which we did, like you said, a one-day version of for the RD group. That was a TC boot camp. But these TC mastery courses we do typically towards the beginning of the year. We've got one coming up in March out in Vegas, and then in the second half of the year, typically in the fall, we'll do one somewhere fun, like we just did New Orleans, and before that we did Miami. But it's a weekend course because I know it's hard to let your TC out of the office. So they just come down on Friday night, and we spend 2 days just pouring into them and teaching them what it means to be a treatment coordinator in 2019. What does the role look like? What are the expectations? Then we kind of map out the new patient experience and how I think the ideal show, as I like to call it, should look like. Everybody's got cues and lines, and there's a dance, and you gotta stick to the steps, and so we kind of map out the script and everything with that, and we dabble in some marketing for these guys. I go through, techniques for closures and how to track your closure rate versus your conversion rate, what the ideal pending protocol should be, things like that. So I've only got 2 days to do it. And our first year we gave these girls a workbook that was about 25 pages thick. And now here we are in 2019, and the book is now 65 pages. So it's a lot of content.
Funny how that happens.
It's crazy.
It just grows. It's funny.
It just grows because every year I develop and I learn new things too, and I want to incorporate it in there too. So and honestly, our industry is constantly growing and changing. So I feel like I got to go over those basics, but I also got to hurry up and get them to current, to now. So that's how that book keeps growing. But yeah, we do that twice a year, and then we even have started doing that for some of the DSOs. Like they'll have us come in and do a similar kind of course too, because they have such a large group. But yeah, I mean, I've been doing a couple lectures lately, so you'll see us there, and some webinars, and so they can kind of get to us, that way. Or you'll see us at one of the meetings, because I like to sponsor a lot of the meetings, and then you can also have us on site for either a limited, what I call a quick fix. It's 2 days on site where we parachute in and we focus on one or two areas of the practice, or we also offer a more comprehensive. See, it's like orthodontist. We offer a limited and a comprehensive, and that one is a straight package where I really look at the office holistically. It's a 360 approach, and it's a 6-month partnership that we do together. I feel like a 12-month partnership is a little bit of an overkill, and it has a little bit of diminishing returns. So I like to focus on a 6-month period there, and yeah, we come on site a couple of times during that one. So that's pretty much it. It's just either come on site, we can do 2 different ways, or you'll come to one of the workshops, or we'll meet at a meeting. So yeah, that's how you'll find us.
So in the interest of full disclosure, I want to tell everybody, as I already did, that you are one of the 50 or so vendors at the Orthopreneurs events. You were there this past year, and I think you were there in 18, right?
Oh, yeah.
Yeah, so you were there from the beginning at 18, 19, and I know you've already signed up for 20. But I want to be clear to everybody that I don't give any preferential treatment to people who are vendors in the meeting. I think I have companies there I don't work with at all, and I have no financial interest in straight consulting on any level. I just love to see good people succeed. But I have had you in my office. You've worked with my team. I have sent team members to your course. And, everybody's different. And I'd love to get into a couple of topics with you here about it, because the whole point of this podcast is to let people learn a few things that they might not have known before we started here. So first question for you is this. If I go out and I find somebody who's intelligent, right? Let's start with that. In our industry, oftentimes, it's hard to find people with really good wherewithal, with good a gray matter who can really think on their feet. But let's just say I find that individual who really is smart, capable, understanding, never in ortho before. Is everybody, if you teach systems and techniques to people, is everybody going to be a good TC? Or are there some people out there who are just never wired to be a good TC? They might be good something else, but they won't be a good TC. And B, the corollary to that is, what are the things I should be looking for in a new hire? Or how can I test for that to know that I've got somebody who I can really train up well?
Oh, good question. So no, not everybody is meant to be a TC. A TC is a unicorn. If you find somebody who's smart and sweet and delivers, great customer service to you, that does not mean that they're a treatment coordinator. That first says to me that they could be a great assistant. Honestly, I see when I interview and I like to use the DISC assessment, personality assessment test. A more supportive staff is somebody I'm going to put in the clinic, or maybe admin up front. But when I'm looking for a treatment coordinator, I'm looking for somebody that's very interactive, somebody who can entertain me in a short period of time, because that's what they're going to have, in the new patient exam. It's going to be a short amount of time. Can we develop a connection that engages me in a short period of time? And somebody who's smart and nice and polite and professional, that's a great thing. I love those qualities, but that's not necessarily what I'm looking for in a treatment coordinator. I need somebody who's able to be strategic and adaptive. I look for somebody who is able to mimic the personality of the person in front of them that they're interacting with. I need them to be able to relate to them and find those connections quickly, and also be able to move them forward in the sale. So they have to be pushing things forward. So I'm looking for we joke and we say we look for somebody who could be a chameleon and a therapist, a psychologist. So
I like that.
They got to be able to do that pretty well too. So
how do you? So I guess my question would be, how do you test for that? Do you have a way of testing for that individual? I know the DISC test will certainly help, but you really need somebody, and I hate to say it because it's a dirty word in our world, but it shouldn't be, because I embrace it and I love it. But we need somebody who's a salesperson, right? We need somebody who understands sales. And is there a way to test for that? Because I've had TCs in my practice now in 5 years. I've had, I think, 3 separate TCs. One is I moved into my office manager position. One left the practice, and now I have somebody new who is new to ortho altogether. And we're training up, and I think the world of her, and I think she's amazing. But how do we test for a salesperson? What suggestions do you have?
So here's the easy way. It's in the interview process. Can she sell herself to each person that you put her in front of and interact with? Like if I had her, let's take your TC. Let's say we take Christina and we said, let's say that she's never met Shaw's group at Dr. Shaw's office. Let's say that this was her first time to interview with her. You were going to interview her. What if you sent her over there and she had to interview with, 3 people from the clinic staff back there and 3 people from the admin staff over there, and Dr. Shaw and, 1 or 2 other people? Can she sell herself to each of those people? Because that's a lot of people with different personalities, different communication styles. Does she seem entertaining? Does she seem engaging with each of those people? And do each of those people say, yeah, hire her, she's cool, I liked her, she was great? Or is she quiet? Is she looking for everyone else to lead the conversation? Is she relying on their cues to move the conversation forward? So that's something that I would do. That's a good way to test.
Nice. I'm a big believer in the fact that salespeople are born, not trained. Mm-hmm. 27 years in dentistry, I've seen a lot of people come and go. And I've learned to embrace the word salesperson and sales, because it tends to bristle. a lot of professionals. I'm not a salesperson. And I remember I gave a lecture in ortho residency. It was kind of interesting. At Nova, everybody had to give a lecture. Everybody who was a post-grad student, endo, pros, perio, pedo, ortho, didn't matter. You had to get up in front of all the years of residence at all the programs once a month. They had somebody get up and give not a grand round, but just a lecture on anything related to ortho that your faculty approved, or or endo, or whatever it was. So they were trying to train you to be able to get up in front of a room and talk. Now, I'd been a professional lecturer getting paid for it for 15 years before I started ortho residency. So for me, there was no pressure to get up in front of, 100 residents through all the programs and all the years. But after it was done, one of the endo residents walked up to me, and Doug Shaw, my partner, you know him well, you referred to him. We laugh about it to this day because he walked up to me, he goes, "Dude, you're a good salesman." And I remember how offended I got, right? It bothered me when he said, "You're a really good salesman," because it implied to me, and I was putting my emotion on it, that I was being disingenuous or I was manipulative. And I was like, really? Like, I'm a good salesman? Like, that's all you can say? He's like, no, dude, you don't understand. And we joke about it to this day, but he said, no, you don't get it. I meant, like, you should be selling like Google to Apple. And it was at that point we like giggled and laughed that he was talking about it in a very positive way, as opposed to when we see like a used car salesman or somebody trying to sell you a timeshare. I think that's how a lot of us see sales. And I think it's important to be able, I believe that a good salesperson is born, not trained. And I think we can make them the maximum potential they're capable of. But if anybody's ever seen The Wolf of Wall Street with Leonardo DiCaprio, there's that one scene where he says, "Sell me this pen." I don't know if you've ever seen the scene. It's a crazy movie, but there's a scene where he has a pen and he gives it to a bunch of guys that "Sell me this pen." And I think he gets to the one guy, everybody fails. It's a great pen. It's a wonderful pen. And the one guy, I think, says, "Okay, I need your signature." and suddenly, the pen has value. But I think that again, I think you are really, really good. And I think your systems are really good at getting the most out of people. And I think it's on us to hire the right person and then to find someone like you to train that person. So, sorry, I just wanted to add that on to anything you wanted to add to that.
Well, and what's neat is, I don't mean to plug this, but it is so hard to find TCs. It really is. And so, I definitely recommend that doctors keep an eye out at, when they go out to a restaurant, do they have this incredible server that just makes the experience more than they thought it could be? You find somebody like that, and you can teach them ortho. We are actually just finishing up this month on the production of, a course that we are doing with Trapezio. It's an online virtual course that is literally going to take somebody, if they were to dedicate their entire day to it, it would probably take somebody about 12 and a half hours to watch the modules, or 12 modules, and they test through it. But it will teach you the basics that we're teaching in the TC Mastery courses, and they can do it from home. So you find that person, you hire them, and then you give them the online training course, and they can watch it over the weekend and come to you Monday morning, ready to go, understanding what it means to be a treatment coordinator, what the basics are, what the format should look like, what the flow and the processes look like, and then they can practice it right away. So it can't be taught.
I've had many consultants in my practices over the years. I've had clinical coaches. I've had a little bit of everything. And I'm a firm believer, as you know, Tracy, that not every consultant can be everything to everyone, right? There are areas that certain people excel in. And I'm not going to mention names, but I've had a consultant for marketing. I've had consultants for TC. I've had consultants for systems and policies. I've had consultants for what reports to run, right? And everybody has their strengths. And it sounds to me, if I was going to ask you, while I know you teach everything and you're good at everything, there's no question, your expertise, your point where you really love to drive into is really the TC relationship, correct? I mean, how to increase your case acceptance. So let's start with that now. Where does that begin? Is it just training my TC, or do I really have to train my front desk to handle the call, or does it even start before that with the first contact? Where in your opinion does case acceptance get won or lost along the way?
Ooh, that is such a good question.
Where are the places they leak out, if you will?
Well, the first place that people, or the first thing that I typically want to address whenever I take on a client, especially when it's a new patient experience or TC coaching style type of client, which almost all of them are. That is definitely my area of focus. I just want to drive sales into the practice. I love growth. So yes, so it always starts with the website, right? I have to be able to find you super, super easy. I need everything to be mobile. I need to have lots of great content on that website that teaches me about who you guys are, but more so what you offer. Because as a millennial parent, I want to be able to go ahead and research what I want. I want to know that I want, clear braces, or I want to know that I want aligners walking into your practice. I want to already know what the product is. I want to understand how it's made, how it works, what's average, as far as not only cost, but what's the average treatment time look like? What does the experience of getting that look like? So if I can put all that kind of content onto your website, that's key. So I think that's a good first stop. And then it goes into contact with the practice, right? So being able to, I need to have a text version of interacting with your office. And then I also would like, obviously just to be able to call the office and make the new patient calls as well. So in the beginning stage with the admin team, I need to make sure that they are on point with their ability to add some soft sales from the beginning, from their first contact and interaction with the patient. So that new patient call, we need to have trial closes in it. We need to be working on connections. We need to be connecting that patient to the practice, to the doctor, and to the team that you guys have, so that new patient call is different than the other two calls they just made before they called your practice. Because as we know, everybody's going on 2.5 consultations. So as a millennial parent,
is that the number?
That's the number.
Is that a verifiable number that the average person who comes into our office is going on 2.5 consultations?
That is what Robert Levin said at AAO. So, and I believe it. That hits my gut. That feels right to me.
I think we'd all agree that there's more than one. My question for you, and I'm sorry, I'm just going to hit you with it now and let you continue about that afterwards. Is it in our best interest to tell people to be the first consultation if we have that ability, or is it best to have them be our last consultation? Or do you want, like if somebody says, hey, by the way, I'm going to be going to other consultations, do you want to say, well, you want to come here first, because once you come to us, you're never going to want to go anywhere else. Once you meet Dr. Smith, once you meet Dr. Corbridge, you're not going to want to go anywhere else, so why waste your time? Or do you want to say to them, you know what, go to 2 other consultations. Don't start anywhere, because when you come here, you're going to really understand what makes us different, and you're going to want to be our patient. Do you have a preference, or does it not really matter?
There's going to be so many doctors that cringe to this, but it does matter, and I want to be the last. I don't care about being the first. That patient already has it in their mind that they want to get some opinions. They're a pragmatic patient, new patient, and they need to get that out of their system. They need to be able to go ahead and go do their pre-search, as we call it. So let them go do it. They already have plans to do it. They're going to do it anyways. Be the last one. And again, how you're presenting in the beginning, in the first impression with your website and the interactions with your admin team there is a big part of that pre-search. So make sure that those systems are on point. But go ahead and go get your wiggles out and come back when you're ready. Because when you come into this practice, I'm going to lock the deal in. You're going to be done. You're going to see how different we are from everybody else. You're going to see that everything I talked about on my new patient call and in my TC call and everything, that what I was promising was real. That stuff does exist, and the experience is right here. And I'm going to close the case. So go ahead and go to the others. And I just push those appointments out about a week and a half, so that they have some time to go to the other ones first.
It's a scary proposition, but I guess if you have faith. If you have faith in your systems, if you have faith in your experience, it's a good deal. And the follow-up question to that, because you did mention a couple of words earlier that many people out there might not be familiar with, and I'd love for you to expand on it just a touch. You use the words trial close. Now, I know what it is, but again, for a lot of people out there listening, they don't know what a trial close is. So do you mind taking a minute or two to explain to them what that means and some basics of how you get that going?
Yep. So I put that into our new patient call sheet. I'm still a believer in a new patient call sheet. I know lots of consultants do that, but I believe that you can focus better on the conversation in a new patient call if you're just taking scratch notes with a pen and paper than you are worrying about getting certain information into certain fields, even though you know what information you need to grab and you're very familiar with the practice management software. I think that you're going to do a better job in being present in that conversation when you're just taking notes on a scratch piece of paper. So that's how I design our new patient call sheets, to just be a scratch piece of paper with a framework that kind of helps the admin team move through that conversation and still grab that important information that we need as far as the demographics go. But it also reminds them to say, hey, you come from here. Oh my gosh, so does Dr. Krieger. He comes from there too. Look at how you guys have this in common. It's about being that matchmaker, and helping that patient realize that this is the place you've been meant to be forever. I'm so glad you finally called. We've been waiting for you. But at the end of it, I think it's important to set proper expectations. Okay. And so that means illustrating what you're going to expect when you come into our practice, what you're going to expect in that new patient appointment and experience with us. And at the end of it, towards the end, if Dr. Krieger does feel like you're ready for some orthodontic treatment and everything sounds great for you, you can even stay and just go ahead and do your first appointment that day. And that's all it is. It's just this a very casual statement, or I'm sorry, question, slash statement, letting them know that is an option for them and that it's very normal. There's no pressure involved. It isn't, hey, you can get started that day. I think we get stuck on the word started a lot because that means something important to us. And I think it adds a little pressure when people are delivering that. But I think it's just a matter of focusing on the convenience of, hey, and if, you have an issue, I have the solution. And for convenience, if you want to go ahead and get started on it, we can, or go ahead and do the first appointment that day. I don't promise what that first appointment is because it could be anything. It could be full braces. It could just be a scan. It could be an additional x-ray. I don't care what it is. It's just that we're going to move the process forward that day if you want to. No pressure, no big deal. And so that's our trial close. It's planting the seed that if everything sounds good, let's go ahead and just save you another trip. And, I don't want you to have to get out of work or get Joey out of school again. Let's just go ahead and do the first check mark, because as a pragmatic millennial mom, I love getting things off of my to-do list. It gives me the endorphins, that little extra feelings that I need. So if you start from the beginning in that new patient call and letting them know that that's just normal around here, everybody just stays and does that first thing. Get that to do list.
But there's two components to that I want to dive even deeper into, if you don't mind.
Sure.
One is what happens. Not everybody's going to respond to that and say, "Oh, sure." Right? Some people are going to be like, "Well, we have 4 consults. You're our first of 4. Whatever." And so, I guess that's point number one, not question, that doing that, they call the trial close, to be clear to everybody out there. It's letting your office know immediately that if you say, hey, by the way, if Dr. Krieger finds that your child or you are ready for treatment, we'd love to get you started that day. And, if the patient goes, well, no, there's no way I'm getting started. I've talked to my husband, or my wife, or I've got to, go check our not insurance, because we already know that. We're not going to get into that now. But, you're one of 3, then that's valuable information to know when your TC sees that patient, right? So one of the things that's important to point out is that you're a very strong advocate of the front desk telling everything they found out to the TC on the call sheet. And that way the TC is not going into a gunfight with a knife, right? They actually know what they've got in front of them. And number 2, it does set the stage for the patient. So it's no big deal. Everybody starts that way. But most importantly, what I was trying to get across, and again, let you follow up on this, is it's so valuable for the rating of the person taking that call to say, hey, on a scale of 1 to 5, 1 being they're not going to start, 5 is they are ready. Hey, TC, before you bring Mrs. Johnson back, this woman is a 1. There's no way she's starting today. So uncover why that is, and let's go after that reason. Or she's a 5, she's ready to get started today. Like, if this woman doesn't pay and get moving today, that we did something wrong. So, right, would you agree that, like, transferring that information from the front to the back, and when case acceptance is no good, just blaming it on the TC is a bigger, broader issue, right?
Oh, absolutely. Absolutely. That is telling us, that is just answering the question of what's the mindset of that new patient, right? Like, how much do where's the motivation? And identifying it from that call is huge. So then I know whether to go in, like you said, like guns blazing, and go, okay, we're doing this. Let's go. We're here. Let's go ahead. Have the doctor look. Oh, he looked. Let's move on. Okay. Yep. Let's go ahead and put those braces on, and matching their expectation, right? That's also the moment that I know whether or not we need to go ahead and schedule a little further out. So when I deliver that trial close question or statement, then I'm, depending upon what they say, they're either going to say, oh, okay, yeah, that sounds good, and I'm going to write that down. Or they're going to say, oh, no, we're just shopping. We're going to go to a couple of people. And then that's when, as the new patient coordinator or the scheduling coordinator, I'm going to go ahead and schedule that appointment. Our next available just happens to be in about a week and a half. That's the trigger point. That's what the indicator for me when I'm scheduling. So if they say yes, then obviously as the TC, we believe in this 3-step setup where you do a new patient call, and then you're going to do an outbound insurance call, and then you're going to follow up with the TC call before they come in. And as the TC, I'm going to read over that new patient call sheet, and I'm going to look right there at that trial close portion and see what my scheduling coordinator wrote as the response from the new patient to that trial close. And I'm just going to piggyback off of that. So I think you were mentioning it perfectly there, but almost sounded like you meant at the beginning of the exam, talking about that motivation. But I would talk about it in that TC call. I would piggyback off of that motivation and go ahead and peel back that onion and find out, what's the hurdle, what would be holding them back, what makes them, if they were to rate it as a 1 or 2, then what's making it cold? Why is this a cold sale? How do we make it a warm sale? How do we heat this baby up? Turn the burners on. So yeah, I agree.
And you mentioned something else again. You mentioned the TC call, right? Something we hadn't talked about earlier. And again, I'm a firm believer that, that there was a TC at one time who descended from Mount Sinai with all the laws of, there was a consultant who descended from Mount Sinai with all the laws of perfect practice, right? And over the years, the word was given from one to another and then another to another. And that some things are really new and some things are not new, or some things were in vogue 25 years ago and now are back, or we've switched it and we played with it and we learned some new things. And one of those things is the TC call, right? Because for years, people have been on and off again about whether we should call patients beforehand. Should we email them? Should we text them? But I really love your concept of the TC call being a way for the treatment coordinator to call them before their appointment to touch base with them and say, hey, I'm looking at my piece of paper here and I know that they're going to go to 3 consults. I have to make that experience exceptional. I've got to peel back the layers of the onion, as you say. And, when we get a hold of them, it's amazing. And also to say to them things like, hey, by the way, we're so thrilled that, your insurance pays $2,000. This is going to make your out-of-pocket so much less. And, that's great news. Or talking about insurance, saying, hey, your insurance, you don't have insurance for adult coverage, but the great news is we've got payment plans that can fit any budget, right? You, like you said, you're disarming them, peeling back the layers of the onion before they come in. But my question for you is this: what do we do with the ones who don't pick up? Like, what do we do with the ones who don't answer? And because we do find that sometimes more often than one might consider, but are you ever a fan of doing that on the first call, or not really, because you don't really have the insurance vetted yet, but you do have them on the phone at that time, right? So what do you do with the patients who just aren't there when you call them back, right? The irony of our phones today is we get really pissed off when someone calls us, right? Like, that's the irony of, the irony of the phone is that nobody wants to use it as a phone. They want to use it as a texting device, an app device, an email device, but nobody wants to pick up a phone and talk to somebody like, you want to talk? It's funny. So a lot of things go to a lot of things go to voicemail. How do you handle that?
You already said it. It's that we don't want to talk. We want it like this. We want this voyeurism. It's weird, but you meet them with the modality that they truly want, which is if you don't get them on the phone. And I think that has some major benefits on it, of course. So that's why it's my first go-to. But the second is that's when your TC pulls out the office cell phone and records a video. Because if I'm that pragmatic millennial mom who was like, I don't know this number, I'm not gonna answer it. So I don't answer it. And then suddenly I get a text message video from, Christine, and she's telling me, hey, I'm your treatment coordinator. I just wanted to put, a face to the name. I'm going to see you guys, tomorrow at 10 o'clock. I just wanted to check in, make sure that worked well for you. Here's the room we're going to be in. I'm super excited. Dr. Krieger and I were just talking about Joey coming in, just make sure you budget about an hour for the appointment. It's a family experience. So bring, mom, dad, grandma, grandpa, anybody and everybody's welcome to come, or they can FaceTime in for the appointment, whatever's easiest. But we're stoked that you're coming. We're excited to see if Joey's ready for some Invisalign like he was asking for. And, we're here and we're ready. Call me if you need anything. This is the number to text me back on. Have a great night. It's easy. Yeah. It's the purpose is to set the expectation, because I'm sure that the admin staff or the front desk girls did a great job with their new patient call. And I've got a beautiful new patient call sheet that's, got lots of great information on it. And here I am, the TC piggybacking off of that. But right before they walk in the door, you want to remind them of the expectations. Because if I've learned anything in life, it's that expectations must meet, reality must meet expectations. They have to match. And so why not, as the sales team, as the salesperson, why not just one more quick, hey, before you come in, let me just set the stage real quick, so that way we're both walking into this with the same expectations. So. Yeah.
And, I had a mentor over 20 years ago, brilliant man, should have been a CEO of a corporation, but he was a dentist, and he was really, really smart. And he taught me a lot of the lessons I've learned today. And we'd meet on Sundays for coffee, and he would just dispense the wisdom of the business universe to me. And I wish we all had that in this world. And one of the things he said to me was, who's a great business owner / clinician? Somebody who exceeds the patient's expectations every time. Mm-hmm. And you can broaden that into, if a patient is expecting an experience in your office, you can exceed that. You're going to blow them away. And I think as orthodontists, we're much more in tune with that versus, say, medical. Right? Like, how many times have you sat in your physician's office and said, if I treated patients this way, I'd be out of business, right? They just don't care on any level. So I think that, if we give a good experience, that's great, but we need to give exceptional experiences, because most of our peers are giving good experiences. I mean, it's rare to walk into an ortho office today and find a bad experience, right? At least the ones I've gone into. And maybe it's self-selecting. But I'm sure when you make phone calls and do your thing, you sometimes shake your head and go, oh my gosh, did they just say what I think they said? So, I mean, you see the good, the bad, and the ugly, right?
Right.
But at the end of the day, if I want to look at my TC's case acceptance, knowing full well the front desk plays a large role with it, do you ever, and I'm a metrics guy, I love numbers, I love ripping them apart. Do you ever look at the readiness to start versus the case acceptance? On a scale of 1 to 5, I had 60, I had 10 ones, 10 fives, and 40 threes this month. And my case acceptance was blank. I mean, can we take a 1 and convert them? Or is the 1 the person who comes in and we just know going in, don't get upset, you're not going to convert them. It's not going to happen. If you get it, great. If you don't, here's a really strong follow-up program. And you have to accept the fact there is a fair share of people that are never, ever going to start in your practice, no matter how great the experience is. Or do you believe you can overcome that 1 a reasonable amount of the time by just offering an exceptional experience? And I mean, obviously, if they came in and you said, hey, by the way, today is free braces day, your 1s would probably convert to the ceiling. And conversely, if you said, hey, today braces are $14,000 and the going rate is 6, your 5s would probably not start. But have you uncovered anything that will help us get those 1s to start? Or is it just sort of, hey, sorry, it's not going to start. I'm going to do my best and make a video and then move on?
No, it's the second. And because you're like me, I've never seen you walk into an exam not thinking that you can't save it. You can, because you have the right you have the right mindset, you have the right intentions. They're coming to you because they want to change something. They didn't just decide they wanted to look into orthodontics for no reason at all. They were just bored one day. So even if you have a bunch of ones coming in, then because of our process, we have multiple touch points with multiple members of our team. So we have multiple chances to turn them into a 5. So exactly. I don't feel like, I mean, there is going to be that one exception to the rule, but it's not going to be frequent. I mean, they may start as a 1 frequently, but they're not going to end as a 1.
No. And I agree with you 100% on this one, because I'm a firm believer that everybody, so as a restorative doc for 20 years, I had a completely different mindset. And when I speak on it, I tell people, imagine someone comes into your office, they came for their 6-month cleaning, and you see, or a new patient because they need a cleaning, and you see every tooth is worn down. Their previous dentist was just observing stuff and didn't really want to rock the boat. And they have a full mouth reconstruction, legitimate, nothing immoral. They truly need $50,000 worth of dentistry, right? Now they came in for a cleaning. You know how difficult it is to convince that person to do the care that's in their best interest? Yeah. And that was my life in Seattle, as you know, right? My practice was a full mouth reconstruction practice. I did a lot of single composites and crowns, but people would come to me. I would diagnose everything they needed in their mouth and would share it with them, and had good case acceptance. And I kind of laugh at ortho, because here, with a new TC, my case acceptance may be 50%, right? As we're trying to train her to do things properly. And yet every person who comes into my office knows what they need and has a rough idea of what it costs. And the only 2 things stopping them from starting are resources or money. And I say resources, I mean time, travel, difficulty, pain, whatever they view it as. Those are the only 2 things that get in the way. So I firmly believe if I can sort of ameliorate or sort of mitigate those concerns they have and say, hey, money, no problem. Here's a payment plan that'll make it work. Oh, time, don't worry. Maybe you want to consider doing clear aligners. We'll see you every 10 or 12 weeks instead of every 4 to 6, right? Like, we can get around anything. But is there a time where somebody's too much of a salesperson, trying to solve too many problems? Is there a point at which you tell the TC, hey, there comes a point where just don't try to sell it anymore? Or is it, hey, it's all fair game until they say, hey, thank you so much, I've had enough?
Oh, that's hard, because I don't know.
You know what I'm asking, right?
I have a hard time to walk away from it, from somebody who wants treatment, who looked into treatment. And I always feel like the answer is yes. What's the question? I can always find a way to get there. But I guess there is an occasion where we've, every hurdle that they brought to me, I've given a solution to, and there are still those people who just won't, there is a person out there that won't be happy no matter what I give them. And there is a point where you do have to say, I've got to walk away from this, but, I want to help you. I have the right intentions. I'll be here if anything changes for you, but yeah, there is that few moment or that few exception where you do have to just throw in the towel and say, I'll be here if anything changes. But no, I mean, I try to meet them as, more often than not, I'm gonna meet them where they need us to be. I'm gonna figure out a way to get what they need. Yeah, they need 7:00 appointments, for their entire treatment time. Yeah, it's a hard one to do, but the answer is yes. So what's the question? So if that means that I've got to make a special arrangement with my doctor that if I charge X amount of dollars, that they'll come in for a 7:00 appointment. If it's only a 10-minute appointment every 6, 7, 8 weeks, 9 weeks, 10 weeks, whatever we got to do. Like, there is a way to get there. We just have to get really creative. Now, that's obviously the most extreme of the extreme, but there's usually a way to get there. But you're right. There is that personality out there that can't, that will never be happy. I know a few of those people, so.
I agree. And so as we start to get to a close here, what is a case acceptance rate, a closure rate that you would like to see a TC have in an office? If you were working with a team and said, hey, I want you at X, and then we'll consider this, like, you guys are really on the right track. Where is that?
I mean, I would say you're on the right track if your TC's, above 85% closure rate. But I want to see them at 90 plus. I want to see them in 95. Like I can guarantee you that we mentioned Jared Corbridge. I know that they have closure rates at 95% on a consistent basis. So I know it's obtainable, but that's the goal I'm going for.
When you say closure rate, can you define what that means in terms
Absolutely.
of if I have 100 people who come in this month, and I had 100 people who came in last month, and last month 80% of the people started during that same month who came in, and of the 20% that didn't start, 10% of those people, 50% of those people, or 10% of last month, start this month, right? Is that closure rate, or is that
no?
What do you consider it?
The way I calculated closure rate is I take the people within a month, the number of new patients in a month, and I also count recall exams. Some consultants don't agree with me on this, but I believe that a recall, or some people call it a recall ready, right? It's somebody who we're going to now give a new fee to, right? We're going to propose a financial fee to. So recall exams and new patient exams, I want the total for the month. And then I'm going to remove OBS from them, and I'm going to remove the number that we didn't present any fees to. So we call those no treatment. So remove those guys because they're not convertible at all. So, and then I want to see the number of same day starts and the number of starts scheduled. So these are the guys that while I didn't close the deal while they were in the office, I at least got their appointment on the books. 80% of those guys, according to Orthofy, and I agree with it, will go ahead and become an active patient in your practice. So
80% of who?
Of the start scheduled. So the ones that put an appointment on the books.
Right.
So 20%
without a deposit.
Even without a deposit. Yep.
Okay.
Even without a deposit. So I'll just take the same day starts and the start scheduled, and then divide that by the number of exams minus OBS minus no treatment. So how many of those did I get to sign up or schedule to sign up? I count that as the positives over the number of exams minus OBS minus no treatment. That is my closure rate.
Got it.
That shows me how well does that TC close at the end of each exam.
So your number is a month by month number. So
Correct.
if I had 100 people come in last month and 40 of those 100 people start this month, that doesn't matter. We had whatever it was last month, and this month we had 100 people come in. 40 were on OBS and weren't ready to start. So that means I had 60 people possible. If I got 55 people out of it, that's the number we're looking at. 55 divided by 60.
Correct. So, okay. But I still think it's important to look at the conversion rate, which is just the total starts over the number of total exams, right? That's the practices. Right. It's a performance number of the practice, right? And like you just said, like that number of starts could have had exams in the month before, the months before that. So right. I think it's an important number to watch. But if I'm going to grade that TC, or maybe I have multiple TCs, right? I'm going to be able to look at that closure rate.
Right. And what's interesting to me is in the 5 years I've been in my practice, you would think this would be the opposite now that I have more people who know what I do and refer and what have you. But my same day start number has dropped now. And I'm not talking like the last 3 to 6 months with my new TC. I'm talking the last year or two. My number for same day starts is lower today than it was when I started my practice, which is weird. But I'm willing to bet there are a lot of people out there who've seen the same trend as greater advertising, greater outside pressures, more on people's minds, more internet information. But it's really been interesting to me. But your approach has always given me hope that, the same day starts will go back up, because those are my favorites, right? The same day start, you don't have to worry about anything. As you always say, 100% of your same day start that day, which is, so true. And that once they leave the office without an appointment, at best they're 50% start rate, right?
Right. Without an appointment, it'll be at best 50%.
Right. Yeah. So I love what you do. Before I go into my favorite part, which is me asking you a few more questions about yourself, if someone wants to get a hold of you, how can they reach you best?
Ooh, good question. Well, my phone number is, well, what I would just do is go to our website. It's straightconsulting.com. I mean, that's the team is going to send it right to me. I'm going to see it at some point. So you just send me a message through it. It's easy.
Okay, straightconsulting.com. And again, you do a course for TCs that you call what?
The TC Mastery course. And there's a tab on the website that explains it all, shows the agenda and everything. So you're welcome to check that out. But TC Mastery course.
Yeah. And like I said, I've had TCs go to your mastery course and love it. I've had people I've had you come into my office and you're amazing at that. And again, I have no financial interest in Straight Consulting, but I really do believe in what she's doing. And if you're out there and you're looking to increase your case acceptance, she's certainly a great resource for you, and I can highly recommend her. So with that, Tracy, my pleasure, because now you say thank you now, but will you say thank you to me in 30 seconds when I start asking you the tough questions? So here they come. Are you ready?
Yep.
Now, these are the same 10 questions I ask every person who comes on the podcast. And so here you go. Okay. First thing that pops in your head, shouldn't take you long to think about it. Most of them are pretty easy, but it kind of gives us a good insight. You ready?
Okay.
What is your favorite word?
Oh gosh, a bad one came in. Favorite word is
if it's a bad one, because you're going to get that question number 6, or sorry, number 7.
Okay. Well, first word that came to mind was the word fuck.
There you go. So you just solved question number 7, which is what is your favorite curse word? Because I will tell you that is the number 1 answer I get for question number 7. So there you go. We know what your favorite word is now. But here's a tough one. What is your least favorite word?
No.
Good. Yeah, to that 5%. What turns you on spiritually, creatively, emotionally? What do you like?
Church music, gospel music. I actually listen to gospel music in the car. I don't think anyone would ever know about me.
I would never have guessed that, but that's wonderful. And what turns you off?
I'm scared to death of windmills. That's the word. Like the wind turbines. It's turbines. They scared me to death.
Really?
Yes.
Is there much fear of you falling into a turbine?
No, they just
or coming in contact with one.
Look scary. They look scary. They're like a pinwheel of knives, like on the countryside. It's freaky.
I want to get you into therapy. This would be great. I got to know where this comes. There's something like at a carnival when you were like 9.
There's got to be something deep.
I'd love to know. So, what sound or noise do you love?
I just love music. I love music.
Beautiful. And what sound or noise do you hate?
My children whining.
Yeah, I know that one. And now number 7 would have been what's your favorite curse word, but we got that one out of the way early, so that's great. So only 3 questions left. What profession other than your own would you like to attempt?
Oh gosh, I love mine so much. I think that I could take pretty much a lot of the things that I do with our current consulting. I could take that to plastic surgery. I think we're very similar.
Yeah, I agree with that. Mm-hmm. What profession would you not like to do?
Ooh, anything dirty. Anything that has to do with like, gosh, anything that has to do with bugs or dirtiness. I don't like to get dirty. I'm not a good camper or anything like that.
So like Mike Rowe's Dirty Jobs, that show is like your worst nightmare.
Oh, that would be awful. No way. Couldn't do it. For any amount of money, couldn't do it.
And here's your last question. If heaven exists, what would you like to hear God say when you arrive at the pearly gates?
I forgive you.
I don't know what he has to forgive you for, but I have nothing to. You've always been amazing with me, and I really, really I love having you in my life. I love having you in my practice life. You are truly a blessing and inspiration to those who know you. And I just want to thank you from the bottom of my heart for you being here today and sharing your wisdom. I hope people out there heed the call and give you a buzz and bring you into their practice because, again, I think very strongly of you. And as I do other consultants, right? I want to be crystal clear to people out there. I'm a firm believer you need consultants for many different aspects of your life. There are people out there who I know in the world of orthodontics who go, I don't need to pay anybody for this information. I can figure it out. And while sometimes you can and sometimes you can't, there are experts out there who can help you through every aspect of your practice. And if you're looking to get your TCs, case acceptance rate better, if you want to understand the interface between your front desk and your TC and case acceptance, I can't think of anybody better at that than Tracy Martin. There are others out there who do it well as well, but nobody better than Tracy. So I want to thank you again for your time today.
Oh,
No,
thank
I mean
you.
it.
Appreciate it.
I mean it. You know that. And so thank you, everybody, for listening today. I hope we've enjoyed this about an hour together. I hope you enjoyed your ride or wherever you were going while listening to this, or the treadmill. But again, one last time, Tracy, if they want to reach you, they reach you at
straightconsulting.com.
straightconsulting.com. Operators are standing by. Tracy, wishing you a great day. Wishing everybody out there in Orthopreneurs Nation a great day. And as always, I'm always here for you if you need anything. And until next time, just wishing you the absolute best. So take care.